there are lots of challenges that face the field. I guess the biggest ones are just knowing how to fit it in with other treatments in terms of the treatments that the patients can have beforehand and afterwards in order to make the CAR T-cell therapy as effective as possible. And some of the biggest questions around that we don't have perfect data for, and I mentioned that at the very end of my talk. So we don't know the best phasing with other immune therapies such as Blinatumomab or Inotuzumab, and there's a general feeling that these immune therapies may be associated with poorer outcomes after CAR T-cell therapy, but it's all wrapped up in the fact that those immune therapies are then being used in patients who already have poorer disease characteristics. And so it's really hard to tease apart whether just by use of those agents per se in two patients that are otherwise identical, whether the one that's received the immunotherapy such as Blinatumomab or Inotuzumab is actually worse following CAR T-cell therapy. So that's at the end of my talk because we don't have data to answer that and we need properly controlled studies for that. And then before that, we've in the field, we've all looked at the challenges of delivering CAR T-cell therapy. In our group at UCL, we looked particularly at trying to improve the toxicity profile of our CD19 targeted therapy, and we achieved a novel CAR that was taken to the clinic and showed very good results in the CAR-PAL study with equivalent efficacy to the FMC63 CAR that's in Tisagen Leukemia, but with a better toxicity profile. And then that's been subsequently confirmed in an adult cohort of adult ALL. So that's all very gratifying, but still small cohorts, and so needs to be borne out in larger scale studies, and a licensing study is currently underway in adults. And then in relation to CAR T-cell persistence, we've recognised that that is a challenge for the field. The real-world data that I presented shows that there is a greater incidence of CD19 positive relapses in patients following CAR T-cell therapy than seen on the pivotal study. And so for those patients, CAR T-cell persistence has been the reason why potentially their leukemia has returned. And so because of that, in the context of CD19 positive relapses, we need to look at CAR T-cell persistence, and the CAR T-cell persistence with our novel CAR was very favourable. So then other challenges facing the field are how to overcome CD19 negative relapse. Again, on the CAR-PAL study, this was one of the major causes of relapse with our novel CAR. And so we looked to see if we could find a solution for that. And other groups have done the same. And I introduce a little bit the concepts behind the different strategies that have been used. And I show very preliminary data from the CAR-PAL study where we've gone into a third cohort. And in that cohort, we're now using a CD22 CAR, which has been specially designed to have characteristics that we hope will make it successful and hopefully demonstrate for the first time that targeting CD22 and CD19 is more beneficial than targeting CD19 alone, potentially. We are a very early stage in that study, so we're excited. The first patient's done well at a very early time point, but it's all very preliminary. We also, I discussed the data that we've collected across a European consortium of CAR T centres that come under the umbrella of the IBFM Resistant Diseases Group. And here we were looking at cohorts of patients for whom they were not eligible on the Eliana study. So these are patients under 3 years of age at the point of screening, or who had isolated CNS disease or CNS leukemia that would have excluded them from the Eliana study. These groups of patients, the outcomes are not clear, and some countries will not provide access to Tisagen Leukemia for these age groups. So it's important to try and collect data across Europe, answering the question of what the outcomes are in those patients that are treated. So I presented data on the younger age range, children less than 3 treated with Tisagen Leukemia, and I presented data that Elad Jacobi has put together and presented at ASH last year on the treatment of patients who have CNS leukemia or isolated CNS disease. And that's to help clinicians in the field and hopefully provide data that can form a platform for potentially being able to widen the indications for Tisagen Leukemia and other CAR T-cell therapies in the future.